If you're like most people, you're very concerned to do anything possible to avoid COVID and its consequences. If so, you may be interested to know that sex hormones may play a role in COVID outcomes. In women, for example, it is known that they are much less apt compared to men to be hospitalized or to die from COVID. Numerous studies have looked at this, and in fact, it appears that estrogen may be what is protecting them. On the other hand, testosterone in men, both low and high levels, are associated with harm, whereas normal levels may in fact be protective. On the other hand, COVID itself can cause a long-term suppression of testosterone. In fact, it's not clear how long it may last, and could be in fact part of what we're calling long COVID. Our own research suggests that sex hormones in men and women could both be a harm or a help depending on how they're utilized. If you're interested in our research protocol, come check out our video at our website. I'm Dr. Jeff DeWester of DeWester Treatment Research Center. We hope to see you soon.